Horizon TV, the beacon for the nation.
Assalamu alaikum wa rahmatullahi wa barakatuh. A very good evening and welcome to Live Real Talk. My name is Faisal Qasim. I mean, it's always a pleasure to have you with us every single Thursday night from 8:15 p.m. going all the way to 9 p.m. And here is where we tell you stories as they are, creating awareness, demystifying myths and facts, separating wheat from the chaff. You get the facts right here from the voices of authority, and thus the name Live Real Talk. And tonight, we're talking about one emotional topic. Last time I spoke about this, it almost made me shed a tear. It is that emotional because I was interviewing a survivor. I've interviewed survivor at least thrice about this topic. The first time I interviewed this survivor was on the 6th of February 2019. And Millicent has a very, very, very moving story. Let's listen to the first part of her story when she was talking about the first time the news was broken to her ears that he had contracted cervical cancer. Aban.
The journey about cancer, if someone heard about cancer in the slum area or in the village, they think about it is only a curse, or you are rejected, or you have done something and it is a punishment from God. When I heard something about cancer, I just imagined it can happen only to the rich one, but it is not the name that we can find it from the poor family. In 2010, it was my hardest year since I was born, because that is the same year I lost my marriage, I lost my child, and it was the same year I started having some discharge. Oh. Okay, 2010. And it went on till 2016. That was when the discharge became more.
6 years.
Yeah, 6 years. And also it graduated, and then I have some clot. I didn't have to use pads because pads were very little, so I have to use the first towel.
Thank you so much, Abashemi. I mean, so touching, right? Imagine, same year, getting diagnosed with cancer, losing your marriage, the same year, losing a child. Imagine how devastating could it be, right? Just for you to understand what you're talking about, on Stay Healthy program, our very own producer, Mohammed Chakombo, did a very nice bite that I want you to listen to, so as you get the perspective and you get to understand what exactly we're going to talk about here tonight. Aban?
Kenya has a population of 13.45 million women aged 15 and older who are at risk of developing cervical cancer. Cervical cancer is more common among groups of women who are less likely to have access to screening for cervical cancer between the age of 35 and 45. Although women are the ones who are prone to cervical cancer, men are the carrier of the HPV virus. The economic burden of cancer is substantial in all countries and reflects healthcare spending as well as productivity due to morbidity and premature death from cancer. As cancer treatment costs increase, prevention and early detection efforts become more cost-effective and potentially cost-saving.
Thank you so much, Abashemi, for that, and I hope that paints a picture and gives you the perspective of what you're talking about. And joining me tonight to talk about this issue, I have Dr. Sitna Mwanzi, who is a consultant medical oncologist at the Kenyatta National Hospital and, of course, many other medical facilities within Nairobi and the country by extension. Dr. Sitna is the immediate former chairperson of KESHO.
Yes.
KESHO is Kenya Hematology and Oncologist.
Kenya Society of Hematology.
Kenya Society of Hematology and Oncologists.
Yeah.
Wow. Wow. Okay, I was just trusting my memory and see if I could get that without reading, man. I'm not that bad, am I?
No.
Yes, yeah. This is just to lighten the mood and to lighten the whole environment, Doctor. I mean, because what you're about to discuss right now is something so heavy, extremely, extremely heavy, and it is something that you have interacted with for the best part of your career, correct?
Right.
This is regarded as a death sentence. When someone is diagnosed with such a disease, then, I mean, they feel like it's the end for them. Like, look at what happened to, for example, Millicent. That was 4 years ago. I was talking to Millicent, and that was her story, right? Doc, I'm sure you've met more Millicents in your line of duty. How is it for them when you break that news?
So it's never easy to tell someone that they have cancer, because most people, when they hear the word cancer, they immediately think about death. But that's kind of like one of the myths that we're here to kind of break, because not everyone who has cancer is going to die from their cancer, because with all the advances in treatments and in prevention, many patients will get treatment and they'll get cured. The main thing is to get the cancer early, because every time we get the answer early, the chances of cure are higher. And even if the cancer is advanced, there are so many other things we can do to make life better for those who have the disease. The other thing that people think about when someone talks about cancer is that I'm going to be in so much pain. The interesting thing is that most times cancer lumps will present without pain, and pain is usually a feature of more advanced diseases. So you could have a diagnosis of cancer but not have, you know, like cancer-related pain. And I think for the issue of cancer of the cervix, for me, I find that this is the most preventable cancer, because you can prevent it by using vaccination, which is targeted to the human papilloma virus, HPV, which is the main cause of cervical cancer. We can screen for it and catch it early using, you know, a screening method such as pap smear. And when we get it early, there is effective treatment that's available here in Kenya. So for me, if there was one cancer that we could say I would focus like 90% of the attention, it would be cancer of the cervix. And this is not just me saying this because I'm a doctor. There's a lot of evidence. For example, in Australia, where they made a concerted effort to this, they introduced vaccination to their boys and girls from the age of 9 years old. They literally have very minimal cases of cervical cancer now.
Doctor, you've mentioned a lot of things that I just want you to take a pause there and let's try and debunk some of these things. You say it is one of the most treatable cancer. Doc, while I was looking into this thing, it is the second most common cancer right now in our country, right? I was looking at the figures and some of the statistics. In 2021, at least 40.1% out of every 100,000 women are diagnosed with cervical cancer, right? And the number the previous year was at 34.6%. The previous year was at 29.4%. So basically, if anything, it has been on an ascending trajectory, Doc, right? And we are still yet to get the facts of 2022, and we're just starting 2023, right? But again, still as it stands, it is the second most common cancer. So how is it treatable then?
So, I mean, so we learn not just from ourselves, but from other societies that have done a better job, right? So our numbers are increasing. One of the reasons they're increasing is that more people are coming up to get diagnosed. And so we are picking the diseases more commonly.
So basically these are people who are affected, they are infected, or they're suffering from cervical cancer from the onset, but again they were just not diagnosed. So you didn't have the numbers.
Yes, we didn't have the numbers. That's one. Number two, the cases have really increased, like a true increase regardless of that. The reason why I'm saying that this is a preventable cancer is because of the things I've told you. This is a cancer we know what is the cause. Many other cancers we can say this is the likely cause, but we know cervical cancer, the origins are changes that are brought about by a virus, and the virus is human papilloma virus. So we know this is the reason this cancer happens. You can get the virus, anyone can get the virus. But
how do you get the virus from, to begin with? How do you get the virus? Or how do you protect yourself from that virus?
So the cervix, many people will say they don't know where the cervix is, right? So you need to define that. The cervix is the opening of the uterus where we hold the baby is when you're pregnant, right? So this is in the it's a reproductive organ, so it's a sexual organ. So this is human papilloma virus is a sexually transmitted virus. The thing about human papillomavirus is that it's a very common virus. And normally, your body will clear the virus. But there are certain types of the virus that are more at risk of giving cancer, so they don't clear. They cause chronic inflammation in the cervix, which leads to changes, and over time, those changes lead to cancer. So this is a process that's not a one-time thing. You get the virus today, it doesn't mean you're going to get cancer tomorrow. 90% of people will clear the virus.
Say,
yeah.
It is, most importantly, it is harbored in the cervix.
In the cervix, yeah.
Most commonly.
Yes.
Harbored in the cervix, right?
Yeah.
But in just the introduction part that we had, by one of our producers, Mohammed Chakombo, says that despite the fact that it's being harbored in the cervix, men are the carriers of this virus.
Yeah, I mean, it's both men and women who are carriers, anyone who's going to have sex.
So where is it harbored from, with the men? Where is it harbored?
So it's harbored in the sexual organ of the man. Yeah, so it's transmitted through the fluids during sex, right? But most people will clear the virus. But if you're unfortunate to get the oncogenic or the type of virus, HPV, that causes cancer, it stays on and is not cleared, and it's the one that causes the changes that will lead to cancer. And this process takes about 10 to 20 years. It's not like, you know, like, what is it called? Like an instant process. It takes time for these changes to occur to lead to cancer.
Interesting.
Yeah.
So you say some people the virus clears by itself?
Most people the virus clears by itself.
How then? How does it happen? Is it by design? Is it by
your
what
body?
They eat?
Yeah.
Is it by the exercise, physical exercise maybe they're doing?
Yeah.
What exactly prompt or accelerates the process of the virus clearing itself?
It's your body's natural immune system that clears the virus. So only those really, the ones that are high-risk types are the ones that now persist and cause this inflammation. So not all HPVs will lead to cancers, but there are those that are high risk that will lead to cancer. And those are the ones that we're interested in, and those are the ones that we target with the vaccine.
Wow.
Yeah.
Wow. Interesting. So you get the virus stays for long, it's untreated, it doesn't clear, then it grows into cancer.
Yeah.
How long does it take to develop?
So like I said, it takes between 10 and 20 years to develop.
That's okay.
Yeah, so in people who have like immune suppression, for example with HIV, that process will take a shorter period of time. So this is why we say we want to give the virus to the young children,
the vaccine,
to the young children before they start having sex, so that we give them the protection before they're exposed to the virus. This is the ethos of giving the vaccine to the young you know, children between 9 and 13 years.
And the virus only develops and mutates and grows when you start being sexually active?
Yes.
Regardless of your age? Regardless
of your age. So like if you are 20 and you've never been sexually active, your chance of getting cancer of the cervix is very low. And this is proven. So nuns, as long as they've not had any sexual contact, the rate of cervical cancer in nuns is very low.
Wow. 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 Interesting information.
Yeah.
Interesting information. About the vaccination, something that a lot of people are hesitant about.
Yeah.
Right? Yes, it's coming with all these preventive measures and all that, but again, many people are a bit hesitant about it. Are there any serious side effects related to the vaccination?
So a vaccine, basically you're giving an attenuated or a modified type of virus, which will bring the immunity without giving you the infection. So these are things that are tried and tested for many, many years before they come into clinical use. There are very few side effects. For example, if I give you the injection, you can get like pain. Obviously, it's an injection, and some people get mild reactions at the site of injections. You might have a bit of body ache, but it's like a normal virus, a normal vaccine. So it's very well tolerated. Very few people will have like a serious effect from the vaccine. So the reasons why many people are hesitant is they say that now I've given that child permission to go and have sex. That's not true. This is just something that prevents them. You know, in the Islamic context, we're going to have sex when we're married. Yeah, the virus is already there. So can you say that I've permitted someone to have sex? It's within the context of where you are. And if this, so imagine if you had cervical cancer, number one, you're going to have symptoms. This lady had a discharge for like 6 years or something like that. She probably had very more advanced disease. She had to go through painful treatments that left side effects, and the cost of the treatment would have been higher. So the typical cost of treating a patient with cervical cancer would be anything between 300,000 to 500,000, depending on where they are.
Wow. Over what period?
Over a short period of time, over like a 2 to 3 month period of time. So that's a lot of money. But how much is the vaccine?
How much is it?
The vaccine, one jab is at the most, the government is giving it for free. So the cost will be zero if you go to a government facility.
Let's go for
if you're paying for it, it's like 5,000 each, and you're getting 3 jabs, so it's 15,000. So compare 15,000 of money that you're using now
to a minimum of at least
like 300,000, and all the things that people go through when they're going through treatments. So the cost saving is enormous.
Okay.
Yeah.
So few things that I'm getting here. Number one, despite it being the second most common cancer, one, it's preventable.
Yeah.
Two, it's treatable.
Yes.
Right? So number one, in preventing cervical cancer, then the most important thing is to get vaccinated.
Yes.
Right?
Yeah.
And number two is to have a good immune system.
Yes.
Which goes ahead and further extends to having good diet, good proper regular physical exercise, and all those things. Is that correct, Doc?
Yes, and then no smoking, because smoking accelerates the rate of cervical cancer development.
Just simple smoking?
Yes. Well, smoking is not simple. People think it's simple, but the amount of damage that it can do.
Nicotine and...
not just for, cervical cancer, lung cancer, bladder cancer, other cancers. So smoking, other diseases, cardiovascular diseases, smoking is never going to be a good thing.
Right now, end month is, we are mid-January, and end month is fast coming. So you need to pay those bills for us to get salaries. So let's go on a very short break, and then when we're back, let's talk about screening. Let's talk about more preventive measures. What should you look out for when you're trying to assess yourself and trying to figure out if you're developing the virus or if cervical cancer is growing in you? So this and much more at the break.
Horizon TV, the beacon for the nation.
I was to be a junior pastor. I felt I was in the wrong belief system. And that's when now I started looking into Islam.
Nilitaka kujua huwa wanaabudu nini.
Because of that experience, I made a decision that almost ruined my life.
Nikaanza kushika hizi verses za Quran. Juu zilikuwa zinanifurahisha sana, especially ukisikia watu wakizirecite.
Nikafunguanga Qur'ani, ilikuwa ya Kiswahili. Nilimanejingi tu kusoma aya moja tu kidogo kabla nipate Mwenyezi Mungu ameumba bingu 7 na ardhi 7. Hiyo ni jambo sikuwahi nimewahi sikia.
I was convinced that Islam is a true religion. I'm getting emotional.
KIPS Technical College is one of the largest technical colleges established and mandated to operate by the TVET Authority. We are a leading institution offering high quality and accessible technical and professional training through a rich curriculum and a professional faculty. We offer diploma, certificate, and artisan courses in business management, journalism and media studies, community development, information and communication technology, hospitality, and tourism. Our students enjoy a serene study environment with well-equipped laboratories and workshops. We offer full-time and evening classes, distance and e-learning. We have 6 campuses located within Nairobi, with Philadelphia campus at Philadelphia Building opposite Afya Center, Tomboya Street.
Our January 2023 intake is ongoing. Apply now to get the best training. For more information, call 0721 134851 or visit our website at www.kips.ac.ke. KIPS Technical College, your sure path to success.
Tauhid Muslim High School ni shule sekondari ya wavulana na wasichana iliyoko Malindi, yenye day na boarding na ina usafiri kwa wanafunzi wa day. Pia ina integration, yani masomo madrasa kama vile Quran, hadith, fiqh, sirra, tauhid na lugha yanafundishwa. Tauhid Muslim High School inachukua wanafunzi wa Kiislamu na wasiokuwa Waislamu. Pia watoto wanaswali swala 5 kwa jamaa na chakula ni kama cha nyumbani. Kwa sasa inawatangazia nafasi za kidato cha kwanza hadi cha 3. Kwa maelezo zaidi piga simu kwa nambari 0702483777 au 0738483777. Tauhid Muslim High School, kwa elimu bora.
Horizon TV, the beacon for the nation.
Assalamu alaikum wa rahmatullahi wa barakatuh once again, and thank you so much for keeping it live. Real Talk. My name is Faisal Qasim, and as I said earlier, it is always a pleasure to have you around. In studio, I have none other than Dr. Setna Mwanzi. Thanks so much, Doc, for making time for us. Before we continue with what we were talking about and the conversation that we were just having during the break, I want you to continue listening to the story of Millicent. Aban?
The first hospital told me that it is maybe a common infection and it is treated. So I got up at the first time and they gave me a lot of medication. Nikajua nitapona. But when I went back after 2 weeks, the discharge was still there. The pain is there at my back pain. I went back to the hospital, but another hospital, and I insist I want to do screening. When I insisted, they did the screening and the doctor just sat down and said, wow, it is cervical cancer stage 4. The time daktari alibreak the message, nilikaa chini nikasema, this is my time to die. Sababu, me and you, tunajua kansa ni nini. Najua venye kansa imeua watu wengi. Na sasa vile nilikaa chini nikashindwa, nitafanya nini? Nikaanza kulia. Daktari akaniambia kansa utibiwa lakini ni long journey. Kwanza kwa hiyo room kuna kuangana picha za cervix, wanakuonesha hii ni symptoms, hii cervix iko clear, hii stage 1, stage 2, stage 3, stage 4. Sasa cervix yako inaonesha hapa kwa screening, naonesha hii stage 4. Ukiangalia picha stage 4, huwezi taka kuangalia mara mbili sababu imekulika sana. Unasema natembeanga nikikaa hivi. So nilipoteza memory. I wanted, vile hiyo memory imepotea, nilidhania niko heaven, lakini nikiamka najipata bado niko earth. By the time uanze chemo, radio, kuna test mingi zinahitaji pesa. In my life sijaishika more than 10,000, na nikaenda hospitali kubwa KNH, wakaniambia biopsy utafanyiwa next year na unataka 13,000. Na nilikuwa najua sitamake kwa sababu unaambiwa next year na already umeambiwa ugonjwa wako iko in advance. Sasa unajishindwa, watu hawako serious. Maybe unawachukulia makosa. Nikajiongezea nikasema ile maisha nimepitia, wale watu wanasema nimelaaniwa, watu wenye wanasema mimi kuna kiboko ya Mungu juu yangu, they are right. That's why napitia hizi challenges mingi katika maisha. Ndio ngarudi kwa nyumba, I decided to go home, Shago. Nipunguze gharama kwa sababu kuna wengi walikuwa wananiambia nende tu Shago nipunguze gharama kubeba mwili kupeleka Ushago. What? I decided to go. Kanda Ushago, nikakaa huko until when I found another gyno kwa Vihiga District Hospital. Akaniambia atanisaidia kufanya biopsy only kama NHIF wata approve. But ndio NHIF wa approve, hawafai kujua ni biopsy because hawa approve biopsy. Sasa lazima ikuwe ni minor surgery. NHIF waka approve, nikafanyiwa biopsy, results zikakuja, and then back to Nairobi nianze matibabu kwa sababu hizo side hakuna
hawana hizo facilities.
Hawana hizo facilities za matibabu. Back to Nairobi. Kakuja Nairobi, by the time nianze another test za kupima lung, CT scan, nini, blood counts. By the time nianze hizo bleeding kakuja abruptly. Nilikuwa nakalia bucket na bleed juu siwezi simama na siwezi eka anything ya kuzuia blood. Sasa nikukalia bucket, mwenye alikuwa karibu na mimi akimwaga, sister in law. Until the day nilianza nikifikiwa hivi, Kenya tunajua ni line, sina damu, HB iko 3, niende niekewe damu. Only on 2017 nimeongezwa 14 pints of blood.
Wow. That's a sorry.
Yeah. That's really sad.
Subhanallah. Must you all go through such?
Yeah, so that's kind of like why we're here. You know, just to say that people don't have to suffer. Yeah. The ones who are diagnosed, there's treatment, like she has mentioned, but we can really prevent our women, our girls, our sisters, our mothers from going through this.
What are some of the, how does it react with men? Because I mean, Millicent has painted for us a picture, how exactly her experience, so at least we have an idea of what our sisters and our mothers and our aunties are going through. But again, what about men? So how does it happen?
What does it happen?
Like the cancer, you know, like you say the virus, it's harbored in the organs, right? But so does it develop into cancer?
So men? So HPV is not only associated with cancer of the cervix. In men, you can get cancer of the penis, and you can also get cancer of the anus where the stool is coming out, and there's some other cancers of the head and neck that are associated with
from the HPV virus.
HPV, yeah. So obviously, cervical cancer is more common than any of these other cancers, yeah? So the burden will mainly fall on our sisters, on our aunties, and our mothers, and our daughters. And that is kind of like why that's a really important topic.
Let's talk about the screening. What happens at the screening? What are you looking for at the screening?
So at screening, like we said, the development of cancer takes time. So there are some specific changes that happen over time, and they become worse and worse over time. Yeah, so the cells keep changing, and the changes get more and more serious towards cancer. So when we're doing screening, we're looking for these changes, the pre-cancer stages, so that we can treat those and they don't develop into cancer. So when they're doing screening, there are different ways of screening. We can do visual inspection. We look at the cervix, and there's some chemicals that are put that can tell us whether these changes are likely to be pre-cancerous lesions or not. Yeah. So
what kind of changes, maybe?
So basically, it's a technique called visual inspection, and we put acetic acid, which is like vinegar, yeah. And we use a tool called a speculum to see the cervix, and then we apply the acetic acid, and the change in the color will tell us whether this is something that looks like cancer or not. So that's one, and if it is, we can do a biopsy and we can treat those areas. The second method is called a pap smear, where we use a brush to get cells and we put them under a microscope and we look and see whether we have those abnormal cells. And the third one is to actually test for the DNA. So we look for the HPV DNA, we test for the virus itself, and if the virus is present, then we know we look for those changes and we treat them before they develop into cancer. Of course, like Millicent, when she was going for, she wasn't going for screening, she was going for diagnosis because she already had symptoms, and that's the difference between the two. Screening is for people who are asymptomatic, they have no symptoms at all, and you're looking for cancer or precancerous
signs or maybe symptoms, yeah.
Millicent is going for diagnosis because she already has symptoms of cancer. And those two are different.
Doc, what are some of the symptoms, maybe, because you just mentioned about it. What are some of the symptoms that maybe when one gets to develop, maybe feel or see, can give an idea, can be an indicator, can be an indicator basically for cervical cancer or any other cancer for that matter?
So I think Millicent has really explained most of it. So she said that she had a discharge. So this is a vaginal discharge, and the discharge can be discolored, it can be foul smelling, so an abnormal discharge. And the second thing that's very common is bleeding. You had, like, towards the end, she had such profuse bleeding that she was bleeding in the bucket. But initially it can be more subtle, that you're bleeding in between your periods, or your periods are heavier than normal, or you're bleeding after sexual intercourse. So the bleeding doesn't have to be to that extent for you to say, oh, I have cancer. It could be just some change in the way that you have your normal, menses and things. The other thing she mentioned was back pain. So back pain is also something that happens usually in
how exactly back pain? Because I mean it comes in different ways.
So usually it's lower back pain, and then even if it's abdominal pain, it will be lower abdominal pain. And if the cancer now has spread to other organs like the lungs,
stinging pain or just a passive pain, or how exactly?
So most patients describe it as a dull, achy pain. Or they might have pain after sexual intercourse, so that's kind of like what they describe. And then if the cancer has spread to other organs like the lungs, then people will present with cough and difficulty in breathing and chest pain, sometimes fluid in the lungs. So that is our more advanced stages. So we said it's like a spectrum. In the early stages, you may have no symptoms at all. You may have a discharge, you may have bleeding, back pain, abdominal pain, and if it's spread to other organs, it will be symptoms related to those other organs.
Wow. Screening, how, where, and when?
So, I mean, I think the government has done a lot, because in any county hospital, sub-district hospital, there is a screening facility. All hospitals have screening for cervical cancer. So,
how much?
In the government setting, it's almost free. It's like a very accessible price, and that's when you're doing things like visual inspection. The pap smear, because it needs more technology, it needs a pathologist to look at the slides. On average, it will cost you anything between 500 shillings and 1,000 shillings. And the thing about the pap smear is that you're not doing it every year. If you have a normal pap smear, you need to repeat it after 3 years. So it's not like you need to do it like every year. If you're doing the HPV, the human papillomavirus DNA test, that costs about 5,000 shillings, and you repeat that once every 5 years if it was negative. So you can see that there is like, it sounds expensive, but imagine the...
I mean, it saves you the cost and time.
And the pain, you can hear her pain. Like, I was going home so that they don't have to transport my body home. Can you imagine not just the physical pain, but the emotional pain that she was going to, thinking I'm going to die, until she met someone else who offered her a solution to get, you know.
So it was like a death sentence.
Yes, you know, like things like blood transfusions will cost you money, you know, needing someone to help you. And imagine, so if she's bleeding like that, it means she's not working. So she's lost her source of income.
She lost her husband,
Yeah.
she lost her
child.
kid.
Yeah. So sometimes we think about cost in terms of money, but there's a lot of cost. There's
Yeah.
emotional cost, there's, you know, physical
Societal.
cost. There's lots of things that we, you know, and if she's coming to treatment, there's the cost of transport. You know, like if you're living, wherever you're living and having to come to Kenyatta, you have to use a means of, you know, transport. Yeah.
That's pretty expensive,
Yeah.
and it must be so hard. Vaccination. How frequent? You say like there are 3 doses, for
Yeah,
example. So
yeah.
how frequent are you supposed to do them?
So if you get one vaccine today, the next one will be in 1 month, and the other one will be in 6 months, and that's it.
You don't need to have a booster or something?
No.
That'll be it?
That will be it. And they're testing to see, do we need all the 3? Can we do 2 instead of 3? So there are all these, like, you know, studies going on. Yeah.
But again, it's something that it's very important. I mean, from the explanation and the discussion that we've had tonight, I mean, it's better be safe than be sorry later.
Exactly. Yeah.
Right? Doc, you are seeing such patient. How frequent, like for example, in a week, how many people do you diagnose and tell them that, you know what, this is the situation? Or you take their samples, you ask them to go and get some lab tests, and then they come, the lab tests come like, these are the results.
Yeah.
Right? So in a week, approximately how many?
I mean, it's like I said, in Kenyatta, cervical cancer is the cancer that we treat most commonly. So it's an everyday thing.
Every day?
Yes.
How many?
So for me, because I mean, it will be maybe, for myself as a person, I'd say maybe 1 every day. But if you look at the group in total, I mean, we are going to diagnose.
Kenyatta is just one hospital?
Yes, there's Kenyatta
in Nairobi.
There's Kenyatta University Teaching and Referral Hospital.
Then.
There are all these smaller hospitals, there are the private hospitals.
So, that's what I'm just thinking. I mean, it's Kenyatta Hospital, one hospital, to Dr. Sitna only, who has at least 1 every day. Yeah,
and that will be like the experience for most people.
What's the success rate for the treatment of?
So we talked about the treatment.
I know you're talking about it during the break, yes?
Yes,
so
yeah.
The viewers didn't get to hear it.
So basically, treatment is based on the stage of the disease, and most cancers are staged as stage 1, 2, 3, and 4. So stage 1 and 2 are much early diseases. Stage 3 is more advanced, but it hasn't spread to other organs, and stage 4 has probably spread to other organs. So the treatments, the cost of the treatment depends on the type of treatment. In the very, very early stages, surgery is possible, and so the cost of surgery will depend on where you're doing your treatment. But those patients have a very high success rate. They would have 80% of patients would have cure, and they would not have the cancer coming back. When you move to stage 2 and 3, we're going to use more of chemotherapy together with radiotherapy, and the cost will vary with the institution, but approximately 300 to 500,000 Kenyan shillings, depending on which institution that you're going to. So the success rate is still high, 60 to 70%. So a bit lower for the stage 3, but much better for the stage 2. In stage 4, then it's a more advanced disease. So our goal there is to control the disease and to
control the spread.
And spread, and to prevent patients from having symptoms from the disease. Yeah. But you can see the earlier stages, you're talking about 70 to 90% of the patients would likely be cured from the disease. So like stage 1, you have very good success rate.
Wow. Wow. Yeah. Doc, your parting shot tonight as we're wrapping up the show.
For me, I think, like I said, this is one of the most preventable cancers, and we have many tools to do it. So my parting shot is, if you have a boy or a girl who hasn't gotten vaccinated, please get them vaccinated for HPV. This will save them a lot of problems and prevent them from getting a very deadly cancer. Number 2, if you're in the screening age, then make sure that you're getting screened with any of the 3 methods we've talked about. We've talked about visual inspection, we've talked about a pap smear or a HPV DNA test. Number 3, if you have any symptoms, it's better to come early. Don't wait until it's too late and you're bleeding in buckets. It's unfortunate. We don't blame anyone because she probably didn't have money to go to hospital earlier, but if you're able to, government hospitals have facilities that are more accessible. Private hospitals are doing their best as well. So going to hospital early as soon as you have any suspicious symptoms. And I think with those 3 strategies, we're going to really reduce the burden of cervical cancer.
Wow. Thank you so much, Doc.
You're most welcome.
Thanks so much. I mean, unfortunately so, all the episodes I've done on cancer, I mean, this is always my mood, especially when finishing the show, because now you have all this information that you just received, and at the same time, you're trying to process all this information, trying to make it make sense. And I don't know, I think the only thing that just makes sense is it's treatable. And you need to get out of your comfort zone right now and go get screened, go get tested. If you're having the symptoms, I mean, just seek treatment. I'll try my level best before the end of this month. I think I'm going to convince my significant other, and we're going to get us the job. Hearing Millicent's story, hearing Dr. Sidna here, that at least one patient every day, results come back to the office like positive. Let's try hard not to be part of the statistics. Please, guys. This has been the Lab Real Talk, and my name is Faisal Kasim. Guys, see you next time. Ciao. Thank you.
Horizon TV, the beacon for the nation.
أعوذ بالله من الشيطان الرجيم. يا أيها الذين آمنوا إذا نودي للصلاة من يوم الجمعة فاسعوا إلى ذكر الله وذروا البيع ذلكم خير لكم إن كنتم تعلمون.
Enyi mlioamini, munapoitwa kuhudhuria swala ya Ijumaa, fanyeni haraka kuikimbilia, muache biashara zenu, hilo ni bora ikiwa mwelewa.
Isikilizeni kwa umakinifu khutba ya Ijumaa
ili uzidi kujenga imani yako na kupata faida nyingi ya siku hii.
Coming to you every Friday from Jamia Mosque, Nairobi.
Live on Horizon TV.
I was to be a junior pastor. I felt I was in the wrong belief system. And that's when now I started looking into Islam.
Nilitaka kujua huwa wanaabudu nini.
Because of that experience, I made a decision that almost ruined my life.
Nikaanza kushika hizi verses za Quran. Zilikuwa zinanifurahisha sana, especially ukisikia watu wakizirecite.
Nikafunguanga Qur'ani, ilikuwa ya Kiswahili. Nilimanejingi tu kusoma aya moja tu kidogo kabla nipate Mwenyezi Mungu ameumba mbingu 7 na ardhi 7. Hiyo ni jambo sikuwa nimewahi sikia.
I was convinced that Islam is a true religion. I'm getting emotional.
The first hospital told me that it is maybe a common infection and it is treated. So I got up at the first time and they gave me a lot of medication nikajua nitapona. But when I went back after 2 weeks, the discharge was still there. The pain is there at my back pain. I went back to the hospital, but another hospital, and I insist I want to do screening. When I insisted, they did the screening, and the doctor just sat down and said, wow, it is cervical cancer stage 4. The time daktari alibreak the message, nilikaa chini nikasema, this is my time to die. Sababu me and you tunajua kansa ni nini, najua venye kansa imeua watu wengi, na sasa vile nilikaa chini nikashindwa nitafanya nini, nikaanza kulia. Daktari akaniambia kansa utibiwa, lakini ni long journey. Kwanza kwa hiyo room kuna kuangana picha za cervix, wanakuonesha hii ni symptoms, hii cervix iko clear, hii stage 1, stage 2, stage 3, stage 4. Sasa cervix yako inaonesha hapa kwa screening, naonesha hii stage 4. Ukiangalia picha stage 4 huwezi taka kuangalia mara mbili sababu imekulika sana. Unasema natembeanga nikikaa hivi. So nilipoteza memory. I wanted, vile hiyo memory imepotea, nilidhania niko heaven, lakini nikiamka najipata bado niko earth.